We are presenting you through these slides our understanding for the primary healthcare digitalization, what solution that we could come with to address a different need that had been highlighted for social health insurance, primary healthcare bills, facility improvement, financing, and other components, which we try to understand. And from the documentation that we reviewed, and we think we will help to provide this slide that comes through can give a clarification of what type of solution we propose. In a summary, my name is Benjamin Nyange. I'm one of the founders of Data Exchange Group. Data Exchange Group, in summary, is a company that is based in Africa, which connects different skills, experts, and also consultants across the continent from different countries to provide technical services and implementation of digital solution to African project. We have a team based in Kenya. We have experts like four, who are working with us and collaborating with different projects. So they will be associated to this project. If we are one of we are chosen to provide service to the project. This is to present the structure, how we propose, and based on our limited understanding from the review of the system for now, for different documentation that we look at. But the structure will be improved based on the discussion, follow-up discussion that we may have in terms of aligning which are the priorities and the scope that need to be addressed based also on the need to focus on. But in globally speaking, we understood that the need is for the PHC is to implement a solution that will help to capture the social insurance bills, which also link to somehow provide assessing how primary care is provided to client or to patient, and also finance the primary health facility based on the service that they provided to the patient or to the community. So, by the way, there are solutions for digitalization which can be set up. Which one is a core could be the OpenEMIS platform, which is a one which is used currently in different countries, in different setup. And also based on our experience, we think could be a good fit to start with. So the OpenEMIS works with capturing a patient, recording patient, providing this SQL, enroll them into an insurance scheme that whenever a patient receive from a health facility a service, so this service are costed, and also like lab exam or whichever medication, pharmacy, and other component that the patient receive from a health facility could be also costed, and the health facility will be given a package based on different service that have been provided to patients. This is one of the core system which we think would be like to start with. And it's also linked with an EMR, electronic medical record. If there is an electronic medical record already built, like as OpenMRS or BAMNI or whichever, this information could be associated to the OpenEMIS. The OpenEMIS is roughly linked directly to OpenMRS, so all the records that are working with OpenMRS can be directly associated with OpenEMIS. So OpenMRS, to say how it works, I will describe it in the next level. So all this system will be associated at the end of the day, have to DHS2. So DHS2 will be the final system that will be accessible by decision makers to oversee how the trend of the insurance, what are the budget line, what is the budget consumed by the health facility for this period and this period, and what are the financial that go to the health facility. So if there are finance institutions that will be supporting the insurance, so the amount, they will have also the portfolio. There are components that within the OpenEMIS which will track the numbers, like the financial, the budget that had been given, and two are beneficiaries and those kinds. The OpenME is a little bit organized in sense of well organized in sense of registering the patient, registering the new insurance, the beneficiaries, and providing them an insurance card. When they go to health facilities, they can receive any medication and receive all the treatment that they need. So their record will be already tracked within the OpenME system that they have received ABC. So these beneficiaries has consumed like per month this budget. So and at the health facility, it will know the health facility will have also a package of what type of service have been provided to people, and this will be the package that monthly will be financed. It can be also added on the top as a aspect like a performance based, and will be lightly easy to track what the service have been given. So as a component, which we think would be interested, is to look at how the community, if there is a need, like to track a part of the insurance, a part of the budget part, to look at the service part as well, like a community level, to follow up or certain disease, follow up patients in the community, or tracking a certain treatment care. So we can look at this, another way to say, okay, we implement open MRS so that we track patients can be also monitored apart from the finance part at the health facility for disease care and other services, as well as within the community level. And all this will be associated to the patient record within the OpenEMIS. This is another structure to look at as I present here. And for the staff, so whenever it comes to the teleconsultation, there are different solutions which need to implement. And the light one, which we will recommend to start with, will be like Rapid Pro. Rapid Pro is one that is used to have an SMS communication in between health service providers, as their headquarters and there's an interfield. So when they diagnose a patient or someone is providing treatment, can also communicate like, for this diagnosis, what can I do? This, and receive an instant communication messages so that it can help to diagnose and to provide a treatment. There are other solutions for teleconsultation that may come through, but maybe we would advise it to come as another phase, because this requires set up a structure after we have the priorities, which from our understanding is related to the insurances and bills, which need to be well organized and well provided. By the way, there is another solution called IHRS, which is also a solution which we can customize, and it will link with a different solution here. So it is also an open source. Also to say that all the solutions that we are presenting here are open source. So they are not licensed based. So we will work, and as our expertise for our startup is to work on open source solution. So we have team, we are skilled to develop those solutions, and they can implement it, and they can have interoperability in between. So IHRS is one of used global for staff, health facilities or healthcare staff, which will be recorded. So if we have doctors, we have nurses, we have whoever provides health services for health facility, they will have their ID in iShares. So, and then if you come at payment, salary, and all those type, all will be organized with health surgeries. So any service, if for example any service that they provide, or like a lab technician or like a doctor provide to a patient, which is costly, this will be recorded within the OpenEMIS. And OpenEMIS, we say, okay, the health service provider number or doctor name or whichever, with his ID have provide ABC services, and which cost ABC. If it's surgery or if it's any type of treatment which is costed, we'll know, the OpenEMIS will track the amount that need to be paid to the service provider. So this is a link that we think would be efficient. This is to present the structure of OpenEMIS, which we think could address well the social life insurance bill. It's an open source. It requires a customization, and to get some time for the team to set it up and for the alignment to the country need or the project need. It can be at a different level, as it's at district level only, or depending on national level deployment, depend on this different level. And based on the experience and how we know the OpenMIS, because our team has worked with OpenMIS and they have experience to implement it. So one of aspect is how the workers this work. So it gets two entry. It has enrollment part. It also has the service delivery part and claim management part. How it works for the enrollment, you can have as an enrollment for an institution, mean like a company or a group of people who want to register their employers or their teamwork within the insurance scheme. So this is one part which can be considered, which can an entry part that OpenMIS support. Yes, it can be yeah, a group of health facility or kind of, but we do not concentrate on that. The one part which we think would be associated to the primary health care is the second one, the informal one, which is a patient, yeah, we community, that someone goes to the community and register beneficiaries for getting who will be receiving the health insurance to attend the health services, the healthcare services. So it can be done, it can be as a unit at the healthcare or at the district level, where an enrollment time will happen, where go to like survey within the community and enroll households. Know that as a opening is allowed to enroll households, mean you can come, you can each household family can have like the members on the same card. So whoever member comes or for the family A or the household B will have the same number. When they go to the health facility will know already that this person come from the household A, and which will also have the list of people beneficial for this household. It's lightweight, and way how it works when the people are registering. So now they go to the service delivery point. So they will attend the service providers, is a health facility or wherever they will gain service health facility health care services. So the service provider at health facility level or as a main doctor a nurse will have a mobile phone. We just scan the QR code of the patient, so of or a service, and say, okay, this person is now registered, will receive the treatment ABC based on diagnostic or based on what the person have already received in the health facility. So means the person arrived at the health facility with his card or her card, and they arrive and the first as a triage level will have someone who will scan the QR code or get an ID. It can be a card, like a paper-based card where there's a number or a QR code is scanned, depending on how we think it is set up. And yeah, and we'll record the patient. I can take the patient, or this can be also done on the community level, like picture, names, and all the details to be registered in the system. So whenever the patient or the person arrive or someone within the household arrive in the health facility, so they can receive treatment, it like the treatment throughout without paying. So because they're already registered in the scheme of insurance, so now even if they are paid, but it will depend on how the system set up. So if they receive considering the insurance when they are not paying, so they will receive the treatment, lab, and whatever services that they need for the health facility. So these services will be recorded all the go within the health facility level, and they will be registered like doctors. They say the person receive like whichever or services, clinical services, and these are costed. Lab results are costed. Lab exam are costed, and at the end of the day, these services will be registered in the system for a claim. So what's a claiming? So mean the health facility will claim to say, okay, we have provided this amount of services. and submit it to a claim management. And at the district level, there will be a claim adjudicator who will say, yes, we look at the claim that this health facility received. It's like a bill that this health facility sent to the district and say, yes, they approve. And when they validate this, and this will be amount, a certain called an amount and attached to the service that the health facility will benefit based on the decision point that will be made. So after this claim management is done, so all the claim adjudication can also assess, ask question, and interrogate and do some other follow-up checkup to make sure that the health facility have provided these services and that kind. But all will be tracked with the same system because it will be light and very straightforward to see. So the monitoring also will be there for the national level and decision maker to also track what are beneficiaries and how the budget is go. And also the other component is also the payment. When the payment is approval, the claim is educating and is educated, the claim has been reviewed and approved. So the budget institution will also deliver the finance. And when the finance is delivered, it can be like a national finance, national or any bill or any fund that has been given as a by from partners, from the different for national, for the ministry on that kind. This will be tracked within the help and image system to know, okay, the partner A has given the budget for this specific to support this specific region. It will be like in a package and this has been consumed and provide ABC. It can be also specialized or can be a partner said, yes, we are just giving for TB for any type of disease, specific disease. It can go into the scheme and for the service that a health facility provide for TB will be the one that will be goes to this finance budget. And it is well organized within an open EMIS structure. This is to present what the EMR is. And we think this could be also beneficiary for if we go on the long or on the line of implementing a health care of primary health care record management, patient record management. It can be or not, depending on the need. But if the open emails can support all the part of the bills that goes to the health facility, that will be already enough. But if it comes that the need to have to monitor what the type of bills or consumables that are aligned for the health facility, this can also be implemented at the part. So we can look at the difference in this. Maybe you can be asked what the difference for OpenEMIS and OpenMRS. So OpenMRS is more about tracking the patient details for the treatment. The patient comes to the health facility and receive ABC, vitals, diagnosis, and receive this type of disease. The doctor can decide, yes, a patient has this type of disease, is healed or this one, or this is a problem, this is a medication. It's an overall organized in terms of what is doing is regularly happening in the health facility level, at health facility level. So all the records for the patient will be tracked, and when the patient comes back again for any visit, they can consult a nurse or health service provider can consult what's the previous visit history of the patient, the diagnosis, the treatment, and follow up throughout the course of the treatment. So the EMR, it has also a component for a mobile app for community. So if we have a community squad or community team that do like treatment within the community, they can go with a mobile device of OpenMRS and go and do the same as a health card as it's done at health facility clinic. But most of the time, this is linked to the health facility level because the people going to the field, going to the community can record, patient can do follow-up for patient that has been diagnosed with that is under treatment at the health facility, or they can also register new patient like for kind of vaccination campaign and those aspects which require follow-up of patient in the community. So the OpenMRS can be a good fit for that. So this is deal with for the difference with OpenMRS is this one is more service providing or clinical services and clinical or treatment or disease treatment, which is also linked to if we want to have this component also offline, it can be there because we have also the expertise for that. Our team has been implementing this for several countries, and we think it could be a good old fit if that comes as a need in terms of prioritization. OpenMRS has also a part of it which it's called a billing component. So whichever when the patient receives all the services, he can also have a bill at the end. But then this bill will be also linked to the OpenMRS component. On this slide, we present what to look at in terms of facility improvement financing as one of priority, which have been identified within the principle for PHC project. So how this work? I think we will all look at just presenting it, how the OpenMRS also will be useful to also address this part. So it works with interoperability. What we call interoperability is that the linkage in between platform. So it will work directly pushing data that would be associated to the finance, to the insurance part, and publish it to DHS2 in terms of to have aggregated aggregated ways that will make it easier for decision maker to say yes, this is a trend of how we see, because the decision maker, they want to see figures, they want to see better to present indicators. So we said, okay, we're for indicator of performance, like for this health facility, for this district, or for this region, this is a consumed, this is a services that had been paid, these are the different budget that has been allocated, these are the number of their staff working there, these are the number of services that is being prescribed, like for ANC, for whichever, if it is a any of the type of service that are that are primarily provided, this will be also displayed there. So for the decision makers, will have this light data visualization to see, oh yes, this is a finance, like this is the budget that has been allocated for this year, for the past year, for this health facility, and we think that we are in a good trend of the budget, that this is budget proposals of kind. So we'll look at, our team will build up this dashboard to give the head up, to give a decision point and monitoring and tracking also the consumed. This will be also linked to also OpenMRS finance and OpenMRS structure, so that it will have an interoperability, which is a layer that allows to connect to different unit, different component, and also display it in a light way. It will be look at a core system in sense. So end user entering the system, we like decision maker, we have a login and we access to DHS2. As someone who collect data, we have a username and we have a mobile device and access to and enter data and whatever. If it's we want to implement OpenMRS as well for EMR, we'll have that component for health facility or not, depending on the need and depending on how we prioritize the different setup and the different components. But it will show how it works. It's a different operability and also can connect outside of the system. If there is a need to have to publish the data for another system, like an artificial intelligence, like Power BI, like any other business intelligence, we'll pull data from the system and just access there and have other analysis that need to be done. So this is what interoperability is about. Thank you. Here we present about the human resource part. So we understood there is a need, while reviewing the document, there is a need to have a human resources component, which we think it's about to have a centralized data or a database where you know who are the nurses, who are the health service providers, or those who provide services for the health facility for within with different, they can intervene in one or two health facilities, like a specialist who, from if we understood correctly, were in the document, who goes in different special health facility and provide services. And their needs, the services provided need to be tracked, need to be if there are costs that are associated, if there are performance that are associated for monitoring their performance, for monitoring the service that they provide, they need to be tracked within the system. So this is how we thought the IHRS will be one of sync solution, which is also an open source of health workforce information system software that will allow to capture and maintain high quality of information health service workforce planning. It will be also planning, management, and also training. And based on it, how it will work regularly, it's a database where you register all professionals that are as providing services. Those to come and those also are already in services. So this health professional will have each one is ID. It will be a human resources which has an intelligence subsystem behind within it that allow to say, okay, when it comes to plan, like we said, for this if we talk about planning for the health facilities, A, based on services, B, based on human resource that we have like 10 experts, 10 specialists. How do we allocate these 10 specialists for these health facilities? It have an intelligence behind to also prescribe already, yes, for these services, this is a consume and how they can be allocated. But you can also allocate them. But the basic use of IHRS is to have this record first record of work of service health service providers to know you have a number of specialists for surgeries, number of pediatrician, number of and have those number and we know their record. And when they intervene in a health facility, they provide the services. So within the health facility, either it's through EMR, through Open MRS, or directly we can also link it to the Open EMIS, the service providers have provided services, have provided service, have provided service, and they are costed. And also the other component for analysis, which can also be used, like as I said, for planning, for recruitment, and those aspects, which can also be explored, but depending on the need. But from the principle of the system, we sought to have first a record of the health facility provider or health services provider will be also a starting point, which will be a link to say, okay, we have a number, everyone has an ID, everyone has a code, everyone is registered in the system. So whenever they go provide a service to a health facility, or to a patient, these services are tracked as they've been provided by ABC, by one or by provider one, or provider B or provider C. And if they're costed related to like salaries, like payments, like if the service like for lab exam are costed, these are kind of things which could be tracked with the system and will allow also on the dashboard at the end of the day, or will be linked to the DHS2, will tell you for service provider like pediatrician. Without we also anonymize this, we also look at care about the data security and personal identification, which this system also provided. So we'll know at the end of the day that there's pediatrician services have been given by number of, and these are costed, which is also to walk through. All these systems already exist and have been piloted. We just need to set them up and configure them. Thank you. Here we present one of components for called Rapid Pro for enabling SMS communication, telecommunication between service providers. How it works, and also know that Rapid Pro is one of known and approved open source solution, which could be linked also to is linked to DHS2 for value of analysis for data center that communicating between health service providers. This will be light one to enable to start with telemedicine need, as we saw is highlighted for the digitalization of the system for PHC network. So this will be the starting point from our understanding, which will be set up when it allows different health service provider to communicate. One can be in the field, in the community, and need to have a diagnosis for a certain disease. We can have preset question that can say, okay, if I diagnose like a TB or I diagnose a child for a certain disease, I just push out a question, customized question, or ask a question, and directly have someone within who is a specialist can already respond. You can also have a database. It also enable a customized database which can also have pre-described questions. Pre-question for this question have answers. Like for diagnosing A, proceed with a process 1 for treatment, or treatment line B, or treatment line C. These are kind of also telemedication medicine which can allow also to starting point within the community. And if it comes that there is a need for a health services provider or specialist who is busy but to know or in a distance to prescribe a certain treatment while the person, the health service, the service provider is in front of the patient or providing services, there are remote service provider can also prescribe, yes, can you treat this, can you ask this, can you do this, can you do this, and it can allow also interaction in between. Or if it comes to the patient himself having the phone, he can also ask question, are you, what are the ill, what are you sick for, what are the symptoms, what kind, and directly have an interactive discussion, interactive prescription, which would be a first light of entry for telemedicine. Yeah, this is a structure for telemedicine app. If it comes the need for the future to to develop a telemedicine app, which is be very light for people, for the health service provider going to community and have like a visual conference or user calls, those kind of. Our team are very skilled to implement this. We can implement it as part of EMR for all projects, which will also be for us again to pilot it. In terms of we develop a telemedicine application, which can also be linked with some other solution like WhatsApp or kind or similar, where we can the doctor or someone being remotely can directly communicate with a video conference with someone being in the field without having internet. So we can figure it out because we have different ways of working with offline solution, which we think can be working up. It will not be a direct, but it could be an indirect communication in sense that we implement this as a mobile network working wherever we have a network which can have accommodate a limited internet connectivity for uploading and downloading data. This could be working. It could be working offline in sense of okay, we have a mobile phone or tablet, someone going to the health facility, to a community, providing diagnostic and have pre-treat, pre-screen or pre-information collected from the patient, and after the collected information, if it's a health facility to be made, it will be also another scenario using the Internet of Thinking devices. We are experiencing with this, with implementing offline electronic medical record, and we think our team will be up to implement this as well. There are other solutions which exist for telemedicine, but they are most of their cost solution. We can also look at them and we think how we can build up and expand our collaboration into this solution offered. Thank you.